My name is Riley. I work as a respiratory therapist at Hamper Community and also in Fresno at CRMC at the Trauma Center.
My name is Joanna. I am a registered nurse in the Hamper Community Medical Center, which will be added as health.
That's good.
Right?
Yeah, that's good. I do anything from simple as giving breathing treatments, assessing patients. I go to every code or crash team call, secure the airway, assist with intubations, run life support. There's many things respiratory therapists do, anywhere from hyperbaric chambers to working in the ER to the ICU to just general floor care, doing home health, and yeah, there's a lot of different fields you can work in.
It's really hard to say exactly what I do, but provide patient care for people that need help, such as you do. Patient care means anything from talking to them, sitting with them, doing their ADLs, which is activities of daily living, giving them medicine, because they need it, especially when they're not doing well and their health is down in the dumps. So working with doctors, other nurses,
talking to families, making hard decisions.
Yep. There's a lot of things. It's not just one simple thing that you can just start to describe our jobs. It's really an array of different.
No 2 days are the same.
Yeah.
That's for sure.
Every day is different. One day could be really, really the same. You know what to expect the next day.
All chaos breaks loose.
Yeah.
Emotionally draining. I'd say you have days that are just average and you do your job and you go home and it's just a pretty routine day, but then you have days like tonight. I mean, I lost 2 patients right at the end of my shift. That affects you. I don't care who you are.
Yep. There's days, especially with us, we work 12 hours in a day. That's half the day. And we start work from 6:30 in the morning. You start at 6 o'clock in the morning, from 7:30 till whenever they need you at night. That's 12 hours solely with your patients and the people that you work with, and anything can happen in between. But it affects us because also, not only if, I don't know, well, I guess I'm saying, because you start caring so much sometimes.
Oh yeah, definitely.
Yeah. If you spend 12 hours in the day with them for the next 4 days straight, you get to know their families, the patient, and you get attached because you want them to do better. But what's hard is sometimes you know they're not going to do better, and having to explain that to them and the families it's really tough. It takes a lot out of you, and in this job you really have to love your job.
I had an older RT once say to me, it was really kind of a simple statement, but it was true, was that he didn't look at himself as a lifesaver or somebody who's a hero or anything like that. He looked at himself, because he's a religious guy, looked at himself as an instrument in God's hands. And that, you know, we do what we're trained to do. We do our best. We try to take care of our patients in the best manner, but you know, you can't ever dictate how it's going to go. You can only do what you were taught, trained to do. The hardest feelings to have with somebody is to know you've done everything, and it's just not getting better.
Yep.
And that you've exhausted every resource, every test, everything you can possibly do, and there's not an outcome that is favorable. I think it's one of the worst feelings.
So you have to be strong to be in this field.
You can only do so much. You can only do so much medically you can only do so much. So, yeah, that is the hardest part. Because, and also the hardest part is when you're trying to educate families and patients about things and they don't understand. But sometimes, hey, you can't change people. You can't expect them to have a certain lifestyle or do certain things differently and understand what you have knowledge about. You can only try to help them that way.
Sometimes I think it's hard for us to remember that we went through an educational process to get to the point we're at.
Yeah.
And we've learned certain things that we take as common sense and common knowledge when in actuality it's not. I think most people have a basic understanding of how the body works, but when you absolutely know what each lab value means and what it does and portrays and shows about what's going on with the patient, and that's how you, I don't know, it's hard to explain to somebody else who doesn't have that understanding.
Yeah.
Because you got to simplify it, but you can't make it sound too simple. It's weird. Does that make sense?
Does it? Yeah, it does.
It does make sense because you're trying to simplify it so they can understand, and at the same time, not make it sound. What's the word? I don't know what the word is.
Complicated.
I don't think it's the end of what I'm going to do, but I love what I do right now.
And one note too is that you never stop learning.
No.
Riley is a respiratory therapist, but he may go on to do something else, such as become an anesthesiologist or a PA, which is a physician's assistant, which provides, you have to have a stepping stone. You have to dream above what you have. And it really, you can do anything with the knowledge base and everything that you started.
Goals are good.
Goals are good.
Goals are good. Keep your focus. Focus on the big picture.
Why do you love your job?
Things I love about my job is I love it. Not every day is the same. I love the fact that I can make a difference in somebody's life. I can make a difference in their family's life. I love the fact that I love the people I work with. I just enjoy what I do. I don't know if there's a simple way to explain that. It's a peace of mind and a peace in my heart that I don't question or regret ever doing this. I'm happy doing it. And there's always something to learn. I think that's another thing. There's always something to learn. It's never old. I don't know if
it's great to know that you love your job. It's important to love your job. I love my job. I think I've been wanting to do this since I was 12, since my grandma was really sick. So therefore, setting a goal for myself and actually reaching it and accomplishing it, it still hasn't hit me yet. And every day I still ask myself and tell myself I love my job because of the people I work with, the patients.
You're good at it.
Just having that knowledge base, learning every day. It's so much. I can't even talk about it. I just can show you. Come over to the hospital, we'll show you what we do. But hopefully in good terms, such as a student or not a patient though, a student.
Yeah.
So we definitely encourage everybody to try to be in the medical field. I'm not saying it's an easy thing. It's hard. It's a lot of hard work, and as I tell my sister, it's a lot of hard work. But when you do accomplish it, it's really, really fulfilling.
Dedicate yourself.
Give it up. Kid's flatlined. It's a lost cause.
Such a thing as a lost cause. Quiet.